I am Lauren Grimsley. I am a PGY 5. I like to say R because I did an additional research year, so I'm a PGY 5. Ooh, highlights of my training. Obviously getting to operate, doing my first ED thoracotomy, getting to know all of my co-residents and co-chiefs, and I don't know, just like learning this really cool craft that I've been working at for 5 years, and I would say those have been the highlights. Getting matching in vascular, that was probably also a highlight. So I don't know, it's a bunch of small moments that add up together to make residency a really fun time I'm looking back on. So I think our program actually does a fantastic job at teaching. There are a lot of residents that are really actively involved in teaching medical students and PA students and really just teaching other residents. And I think that's been a really cool thing for me to see, especially now that I'm a chief, because I'm seeing residents that I taught how to play central lines and chest tubes, walking new interns how to play central lines and chest tubes. And it's a really cool cycle that I'm glad I've been a part of. As far as research opportunities, it really is, this is a residency of what you make it. If you want to put your head down and operate your tail off for 5 years, this is the place for you. If you're interested in research, you can take a research year. And I worked in the basic science lab, vascular lab, and I felt like I was really productive and have some really cool research opportunities from that. And there's a ton of clinical opportunities for research here as well. There's so many attendings that have ideas, and because we are so clinically active, they just need someone to take the reins and run with it. And if you're that kind of person that is driven and self-motivated, then you'll be extremely successful. Knoxville has 4 real seasons, which I'm from Charleston, South Carolina, which I think is summer 8 months of the year. So it's been really nice to have a fall and a winter and a spring and a summer, and seeing the leaves changing. It's so close to Smoky Mountains that, again, I'm from Charleston, which is on the water, on the beach, and living in the mountains has been a new experience for me. So it's been really fun to go hiking and seeing the leaf change in October. Knoxville is actually very, my husband and I joke, interestingly apportioned 3 hours from everywhere. It's 3 hours from Atlanta. It's 3 hours to Nashville. It's 2.5 hours to Lexington, and it's 2 hours to Asheville. So tons of opportunities for weekend trips. And for when I was looking for a residency, I wanted someplace that was within a day's driving distance to home. So it's only 6 hours to Charleston, which has been really nice for me to be able to keep up with my family. Ooh, so many reasons. I would say first and foremost, the residents. When I came to the dinner the night before, it was just so warm and inviting, and the residents' kids were running around, and everyone seemed to really enjoy each other's company, and we're excited to see each other outside of work. And when I was searching for a residency program, I wanted to find a place that had about 4 to 6 residents a year, because I wanted to be big enough that it could sustain itself, but small enough that I knew everyone. And it needed to be within a day's drive of Charleston, South Carolina, because my husband and I are both from there. And third, and probably most importantly, I wanted to operate early and operate a lot, because you're a surgery resident, and I wanted to learn how to operate as an intern. And this is definitely that program. You're expected to know how to be very technically skilled and clinically active from day one. And I could not have been happier with my choice. I feel like I'm very prepared, and I've been very supported here. And I was interested in pursuing a research year, and I came to my grant program director and said I was interested in getting an MBA, and they helped support me through getting an MBA while I was a surgery resident during my research year. So this is definitely, like I said earlier, a program that it is what you make it. You get what you put into it, and they want everyone to be successful, and they really will bend over backwards for you. So it's a very supportive program.